The COVID-19 pandemic has been the cause of a lot of concern for the past 2 years. But with the world pulling in its resources and researchers working tirelessly around the clock, we received not one, but multiple effective vaccines that immunize and protect us against hospitalization and death due to COVID. But vaccines are not simple, everyday things we encounter in our lives, so misinformation spread quite easily across the globe. This misinformation places a great hurdle in the path to ending the pandemic. There are some COVID vaccine myths that have taken a hold in Sri Lanka as well. Epidemiologist Dr. Dinu Guruge helped debunk and demystify some of the most common myths Sri Lankans believe. Here they are. COVID vaccines are not safe because they were developed so quickly. The reason why the vaccine was developed so quickly was because COVID-19 affected the whole world at once. There was increased access to resources and funding, resulting in a team effort, combining knowledge and skills from around the world. The vaccines passed through all the research phases and concluded the necessary trials successfully before being rolled out. Vaccines cause infertility and are dangerous for breastfeeding mothers. The initial round of vaccines were administered when there was less data. Hence, precautions were taken to vaccinate groups it was known to be safe for. Today, there is plenty of data that shows it is safe for pregnant and breastfeeding mothers. Many vaccinated women have already delivered babies safely. The data also shows that it does not cause infertility in men or women. The vaccine with the highest quoted efficacy is the best vaccine. All vaccines have been proven to be efficient in reducing hospitalization and deaths. Sri Lanka has been using vaccines with relatively low quoted efficacy rates as well, and these have shown effective results. Over 90% of COVID deaths were unvaccinated individuals, indicating the vaccines are working. A vaccinated person cannot spread COVID-19. Vaccines do not prevent you from getting COVID-19. They prevent hospitalization and death. Though they are unlikely to suffer from COVID-19, vaccinated people can still spread the virus to unvaccinated people or to each other. Strict adherence to health guidelines is vital until most of the population is inoculated. Vaccination is not needed. Infection and recovery will make a person immune. For older people or those with comorbidities, contracting the virus can be fatal. Vaccines protect them and prevent healthy, younger individuals from infecting vulnerable people who cannot get vaccinated. Vaccination is the most effective way to end the COVID-19 pandemic and save lives. We must do our part to protect ourselves, our loved ones, and our fellow citizens.